one of the things we haven't discussed is the emotional impact on a stroke. And obviously the emotional impact is greater if there's longer term disabilities. How do you work with patients as part of the rehab program on that?
Stroke itself can increase the risk of depression and anxiety, not only for the stroke victim, but caretakers take a lot of burden of this as well. And many times the toll on their health is quite significant as well. So yes, you do have to screen for this. So we talk about that on the appointments.
Screen for this meaning?
For depression, anxiety, problems with coping. We have also, for example, at that center where I work, at Baptist, we have a monthly session where stroke victims and their relatives or caretakers can come in and they can talk through other persons that had the same thing, or talk to a social worker or psychologist or whatnot, to understand how other people deal with the same problem. So that also helps. Not everyone has that, of course, but it does increase the risk.
And family members are really important in this support network, post-stroke or post any disease, of course, and you have to engage them in education.
Correct. And like I mentioned earlier, the person might not realize that they're having another stroke. So you really have to. And I think
that's the main, and I think that's the really big takeaway from today is that's the real make or break, if you will, is recognizing it early for yourself and for family members or whoever you may be with at some point.
Yeah, I hope someday when we talk about FAST or stroke symptoms, it's just like heart attack. We've done such a great job with it. You know, if you go like this,
right, you know you're having
everyone
a heart attack.
is like, oh, heart attack, right? But for stroke, it's a little more complex, and you have to understand that if you're losing functions, you're all of a sudden losing function. That's when you should think about stroke, and FAST helps with this. But if you don't recognize it promptly, then treatment's going to be delayed, and then the outcome is going to be not as good as it could have been.